So chapter 21 is going to specifically talk about things that block the drugs that we mentioned in chapter 20. So on these, we call them anticholinergic or cholinergic blocking medications. So if you think about, we were mentioning the rest and digest from chapter 20. If these are going to do just the opposite of that, they almost speed everything up. So they do just the opposite effect with that. So we'll look at some of those here. They're going to inhibit or block that ACH. So it's going to block that parasympathetic nervous system. We call them anticholinergics or parasympatholytics or antimuscarinics, usually anticholinergics. They work by competing for binding sites for that ACH. I always think about it like football players. So a football player would knock an anticholinergic medication or a cholinergic blocking medication would knock the ACH, acetylcholine, off of that receptor. So if I've knocked it off, then it can't do the job that it usually is used to doing. In small amounts for my cardiovascular, it will decrease my heart rate, and in large amounts, it will increase my heart rate. So knowing dosage for specific drugs is important for some of these medications. I'll make sure to mention that when they are. Also in our CNS, small doses are going to decrease that muscle rigidity and tremors, but in large doses, they're going to cause drowsiness, some disorientations, and can also cause some hallucinations. Moving on to the eyes, it's going to be just opposite of our cholinergic medication, so they're going to dilate my pupils here. They're going to they decrease that accommodation from paralysis of the ciliary muscles. And my GI system, they're going to relax my GI tract. They're going to decrease GI secretions, and they're going to decrease motility and peristalsis. So when I'm saying these are the things they're going to do, you can already start thinking of some instances where we're going to use these anticholinergic medications. First one here, if I have somebody, this is an anticholinergic medication. If I'm anticipating an overdose of this, what are we likely to see? Well, D, if we look at it, because what was happening in an overdose would cause that alteration in our mental status here, because we are going to see that flushing dry skin and those mucous membranes, but some of the other serious effects are located here. When we have an overdose for these, we usually give our activated charcoal to help absorb any of those anticholinergic meds that are in the system. Drug effects continuing, we're going to see some GU effects, such as relaxing the detrusor muscle, which will cause urinary retention. So think about in cholinergic, causing that bladder postpartum or post-surgery to relax and help them urinate. This would be one that would help with urinary retention. I think about this one with women who have had multiple vaginal childbirths, and as they age, they tend to lose some of that sphincter control. So these medications might help here. Ditropan would be my medication for that. We'll talk about that specifically in a minute. They're also going to decrease bronchial secretions, salivation, and sweating. In my respiratory system, they're going to decrease those bronchial secretions, which we mentioned up here, and dilate the bronchial airways. So think about it as far as making breathing easier to do, because we're dilating those bronchial airways there. It can decrease rigidity and muscle tremors, so we're going to see these in use with our Parkinson's disease. We talked about these with our Parkinson's drugs, and it's not specifically doing anything on the Parkinson's itself. It's just decreasing some of the symptomatology that we see with our Parkinson's patients here. So noticing that. Our indications are, why are we going to use these medications? Our indications are going to be if I need to slow that heart rate down. So it's going to, by affecting that heart rate in low doses, it can slow down the heart rate. So think about somebody who has a high heart rate and we're trying to slow it down, such as somebody with tachycardia or palpitations. And high doses, it's going to actually mess up the pacemakers, which can give us an incredibly high heart rate, very high tachycardia on those individuals. When we utilize atropine, which is my drug of choice over here for my anticholinergic drug, we use this for our cardiovascular disorders, especially when we have a specific heart block, which we'll talk about next year in pathophysiology, where my heart isn't, the electric impulses aren't speaking well to each other, so it slows down that heart rate. We can give atropine to speed up that heart rate when it's extremely slow in bradycardia. Some respiratory indications for our anticholinergic drugs are to help bronchodilation. So specifically, it's going to decrease those secretions from the nose, mouth, pharynx, and bronchi. So think about pre-surgery. If I'm trying to dry up somebody's secretions before we stick an endotracheal tube down into their trachea, they might receive cholinergic blocking medication, so it'll dry those secretions up. It's also going to help relax that bronchi and the bronchioles, which reduces the airway resistance and makes it easier for individuals to breathe. Also can be used on individuals with those chronic problems, such as chronic bronchitis, where those airways become narrowed and constricted. Asthma, which again, same thing. We'll have those individuals whose airways are constricted. It'll help open those up. And then same with our patients with those chronic obstructive pulmonary disease. It'll help dilate those and make it easier for them to breathe. For indications in the GI tract, it's going to help with gastric motility. So it's going to decrease those secretions, decrease that GI and GI motility and peristalsis when I block that PNS. So blocking that PNS will cause that decreased GI motility. I think about diarrhea with this one. So if you think about somebody that's had lots of GI motility, I'm trying to stop that. I can give them an anticholinergic medication, and it will help stop that. It'll block that PNS. So we use it specifically for individuals with irritable bowel disease and then hypersecretory states, meaning their GI system is on overdrive. Genitourinary, I might have it on an individual that has that neurogenic bladder, like I mentioned earlier, somebody that has a hard time holding their urine, somebody that has a frequency with urinary incontinence would be a good candidate for this. So if we look at one of our medications, even if you don't know what this is, we're gonna say this is an anticholinergic medication. What is my use pre-operatively, so pre-surgery, with an anticholinergic medication? What do you think it's going to do with these? C should be my answer. It's going to decrease those secretions before and during surgery because you don't want those individuals to aspirate any secretions. Contraindications. I think we say this every time. So our drug allergies. Our glaucoma comes up again. We don't want to give it in individuals with asthma or respiratory distress because in acute asthma or acute respiratory distress. So think about that in a non-acute setting. It might be more applicable to somebody with a chronic problem. That's what we mentioned up here. We mentioned chronic bronchitis and chronic obstructive pulmonary disease would be a good fit for it, but not an acute situation. We could use it in somebody with an acute cardiovascular instability so that we could increase that heart rate. And then it's going to be contraindicated in people with GI or GU obstruction because they're not able to, for some other reason, there's an obstruction. It's not the muscle, the sphincter muscle that's holding it. There's an obstruction that's keeping that urine in the bladder. Adverse effects, this is right out of your textbook too. There is a nice going through each body system here. So going through the cardiovascular, the CNS, these are adverse effects. So we're likely to see these on our individuals that are taking our anticholinergic medications. And then working down through each of our systems there. Even if we don't know what this is, we know it's going to be an anticholinergic medication because that's what we're in. So what are we going to assess for prior to giving it? I think we mentioned this one, that narrow angle glaucoma is going to be my thing that we're watching for on that one. Detrol is actually one of our medications over here that we're talking about with our anticholinergic medications. If I have somebody that's we're looking at for signs of toxicity and overdose, We're going to treat them symptomatically and provide supportive treatment. We are going to monitor their heart. That's what this electrocardiographic monitoring is. We can give activated charcoal so that if there's anything in the stomach, it can help bind with that. And then we can treat shock by giving fluids if they need that. And then if all of this isn't working, we can give phosostigmine, which will help be the antidote to our anticholinergic medications. Our interactions for our cholinergic blocking or anticholinergic medications. We mentioned our tricyclic antidepressants on Tuesday, antihistamines such as Benadryl, and digoxin, which we'll talk about when we get to our cardiac stuff. When I give them with other anticholinergic drugs, they can have that additive effect, so it keeps increasing the intended effect to almost too far the other way. 5 drugs here. My first one is that atropine. Actually, I think I'm going to start a new video, and it's going to go through each of these drugs real quick.